Hey, welcome back in with Dr. Decontee. Jimmeh is with us today. She is a neurologist with the Norwood Clinic. Good to see you.
Good to see you.
And welcome in for the first time. I'll shake your hand for sure. All right, so we're talking about nerve pain in the feet, and you say that it can be caused for a number of reasons, but you got to find out if it's really what's relating to it and causing that pain, right, before you treat it.
Yes, as patients come in, the biggest thing is to ask about certain symptoms that they're having. There are many reasons. It could be neurologic in nature or orthopedic. So the symptoms they describe help us a lot to determine what the cause is.
All right, let's go to, I think we have Tervis on the line in Bessemer. Tervis,
Yes.
you there?
Yes.
Hey, go ahead with your question.
Okay, I'm wondering if a medication like Lyrica would help with my situation. I know it's used for people with diabetic pain and nerve damage from that, but I'm wondering, mine was caused by systemic lupus, and I'm wondering if that would help my situation as well with
The medication,
my problem.
Lyrica, is that what you were asking?
Yes, ma'am.
Yes, Lyrica is one of the medications. It's in the anti-seizure class of medications, but it's very helpful in dealing with nerve pain, and particularly the burning and tingling sensation that you experience. It helps with that. If you are in fact diabetic or have another systemic illness like lupus, it's really important to treat the actual systemic disease aggressively in order to prevent what's causing the nerve pain to begin with, because if you can imagine, the medicine will just mask the symptoms, but it won't treat the underlying reason for that. So, but Lyrica, another one that's commonly used is gabapentin. All of these medicines help to calm the excitability or the nerve pain itself.
Now, like with any medication, is it one medication doesn't fit everybody?
Exactly, exactly. So some patients can't tolerate the side effects of one medication. It's very dose dependent. We encourage physicians and patients to start low and slow. So we usually start the medication at a lower dose, and then as they tolerate, we increase it.
All right. Again, if you have a question, give us a call at 941-741-9272. What do you see? What's the most common thing that you see people coming in with pain in their feet?
So the most common cause for that I see as a neurologist is, of course, neuropathy, and that's always a tricky word. People say, well, what does that really mean? If we think about our nerves as a cable cord, the wire itself we would term the axon, and the insulation wiring would be the myelin. If there's a problem with either the cord itself or the insulation, you would have a bad signal, so to speak. So our nerves help us to sense the environment, and it helps us to move in the environment. So some of the symptoms you would see would include numbness, tingling, burning, and sometimes even weakness.
Let's go to David's in Leeds. David?
Yes, ma'am.
Go ahead with your question.
My question was, I've been diagnosed with arthritis with my spinal cord and everything, but I've also been having a lot of popping and everything in my left foot, and I was just curious, could that be nerve related or arthritis related, or what?
That's a really good question, because nerve pain can mimic other causes of pain, one of which can be problems with the ligaments or the tissues in the foot. It just depends on the symptoms that you're having. Can you describe a little bit more of what you're experiencing?
Okay.
Hey, David, I think if you can turn your TV down, I think that'll help you out a little bit.
Okay.
That you're getting the feedback. And can you hear us, David?
Yes, ma'am.
Okay, she just wants you to describe your pain a little bit more about what you experience.
Okay, when I'm turning my foot from the left to the right, it'll cause a popping, and then it shoots the pain from up and down the actual the ankle and around the heel of my foot.
Okay. The popping sensation you described makes me think more of a musculoskeletal etiology or reason for the pain. I would probably start with like a plain film of the foot to make sure you're not having any type of arthritis in the foot. But again, if you describe any or notice any numbness, tingling, burning, those types or stabbing type sensations in your foot, yes, it could be a nerve pain, but your symptoms make me think more of bone and muscle and tissue type issue.
So have you had it looked at, David?
Yeah.
I think we've lost him.
Okay.
I haven't yet.
Okay, well, I think that's the next move then.
Okay.
All right, David, good luck. Let's move to, Pat, I'm sorry, we're out of time. We took a lot of time with those. Pat, if you'll hang on the line, we'll have the doctor talk to you off air. We'll take a break, be right back.